Hi, I'm Kiana Rush, and this is week 8 of pharmacology tutoring for Southwest College of Naturopathic Medicine. And in this video, we are going to be going over NSAID drugs as well as acetaminophen, which is not an NSAID. This image at the top is great. It's from the University of Oregon. I really like it. What I like about it the most, so we talked a little bit about arachidonic acid in the eicosanoids video. Remember that this arachidonic acid comes from cell membranes during inflammation. It's broken by phospholipase A2. Okay, but then arachidonic acid goes to make a bunch of other inflammatory products. One of them is COX-2. This is the big bad guy. He creates inflammation. COX-1, on the other hand, is more responsible for homeostasis. So it'll regulate the GI tract, it'll regulate how much blood gets to the kidneys, it helps platelet functions, then you can make blood clots, and it also helps macrophage differentiation so you can, have phagocytosis. NSAIDs are not opiates, but they're often combined with opiates in tablet formulations. So something like Vicodin, you'll take after you get your wisdom teeth out. Make sure you take that with food, by the way. That's all I'm gonna say. I got my wisdom teeth out, and obviously you don't want to eat, but it hurt. You need to take Vicodin with food. Anyways, Vicodin I think is mostly Tylenol or acetaminophen, but it does have an opiate. But these NSAIDs can be combined with an opiate in tablet formulation. They block the COX enzymes from getting made, and COX usually makes prostaglandins. So in essence, NSAIDs equal less prostaglandins. Less prostaglandins in the stomach could cause ulcers. Remember, because COX-1 is actually protective of the stomach. Less COX-1 is also going to lower renal perfusion, and it's going to lower the kidney function. You're not going to be able to secrete potassium, and you're going to get hyperkalemia. Also, your kidneys aren't getting perfused as much. You're going to get edema, and you're not getting that salt out, so you're going to retain sodium. So there are definitely some side effects to NSAIDs. Even though we think that they're pretty safe because we can just buy them over the counter, they can be dangerous. All right, and let's get to the drugs for this week. Okay, aspirin. Aspirin acetylates COX-1 and COX-2. This is why it's a non-selective NSAID. That's what it means to be non-selective. It's doing COX-1 and COX-2. And since it does COX-1, which is normally homeostatic for our platelets, it's going to shut down the way that platelets can aggregate, and that's why it thins the blood. It's useful as an analgesic, antipyretic, anti-inflammatory, antithrombotic, and prevention of colorectal cancer. This is interesting. I don't really know the mechanism behind that, but I'd like to look into it a little bit more because colorectal cancer actually runs in my family. Some side effects of aspirin: increased bleeding, obviously it's a blood thinner, tinnitus, so it's ringing in your ears, hyperventilation, and that actually might follow this metabolic acidosis. Because the lungs are okay, but the kidneys aren't letting go of enough hydrogen, and because of that, the person hyperventilates to try to get rid of some CO2 to lower that acid balance. And I remember acidosis, aspidosis, hyperthermia, coma, and it also can cause Reye's syndrome in children. And it's reversed via oral activated charcoal. Once when I was younger, my dog ate an entire bottle of Ibuprofen, Advil, the kind of candy-coated ones, and yeah, my mom had to give her charcoal, and she lived though, so charcoal works. It was a great dog. She was a Bouvier de Flanders. All right. Ibuprofen. So ibuprofen is good. Let me fix my typo here. It's Advil, over the counter. And this is my NSAID of choice. If I have pain, typically, I'll take ibuprofen. It's also non-selective, and we just said what that means. I'll let you think a little bit. So it's shutting down COX-1 and COX-2, same as aspirin. Can be used for similar things. One thing that's good to point out is closure of a PDA, also known as a patent ductus arteriosus. And I put an image down here because naproxen will also close a PDA. Naproxen, over the counter, it's called Aleve. This one's also non-selective. What does that mean? Shuts down COX-1 and COX-2. And it's also good to know that ibuprofen and naproxen are both reversible. But know that they're also non-selective. And that non-selectivity is what leads to those side effects. Also used to close a PDA. Here's that image of a PDA. So it's good to know that naproxen can interfere with the antithrombotic actions of aspirin. So if you have a patient who's taking a baby aspirin following, an MI, don't give them naproxen because it can interfere with that aspirin. And it's contraindicated in people with asthma, hypertension, ulcers, like a stomach ulcer that's pre-existing. That's a side effect of NSAIDs, and people with low kidney function. All right, so those are all of the non-selective NSAIDs: aspirin, ibuprofen, and naproxen. All of them will inhibit COX-1 and COX-2. Ibuprofen and naproxen are reversible. Okay. I have no idea how to say the name of this drug. Celecoxib. Sometimes the faster you say something, the better you sound. That's good advice for when you're a doctor. And this drug is COX-2 selective, so we like that. Why do we like that? Let's scroll up a little bit for a second and review this table. So COX-2 selective, that means we're only shutting down that inflammation, and we're saving all of these homeostatic mechanisms, as where ibuprofen, naproxen, and aspirin will shut down both of these mechanisms. So celecoxib is only working on COX-2, and it's really helping to fight that inflammation. I remember because there are 2 C's in celecoxib. So COX-2 has some of the same uses, but one thing that's important to point out, it has a greater risk of thrombosis. And I'm going to let you think about that for a second. Why do you think that is? Well, since it's selective for COX-2, we're not getting any of those, platelet effects in COX-1. Aspirin is effective at thinning the blood because it also affects COX-1. Because celecoxib only works on COX-2, the platelets are normal and they can still clot like normal. So this won't have a blood thinning effect, and therefore has a greater risk of thrombosis. Okay, and the last drug to talk about, which is not an NSAID. The first 4 were NSAIDs, so aspirin, ibuprofen, naproxen, and celecoxib all work on COX and are NSAID drugs. Acetaminophen is kind of its own thing, also known as Tylenol. Nobody knows the mechanism of action. Nobody knows. I don't know why it's used if we don't know how it works. Kind of scary. Analgesic, antipyretic, and it can be used as a tablet or suppository. And In what circumstances do you think you would use a suppository of Tylenol instead of a tablet? Well, what if you had a kid who had like a gastroenteritis and they were vomiting profusely and they couldn't keep down a tablet? Well, if you need to reduce their fever, it might work a little bit better to give them a suppository. But as naturopaths, sometimes we like to support a fever and don't always like to suppress it. So remember that too. Some side effects of acetaminophen: it's extremely hepatotoxic if you take too much. And it can be the worst in alcoholism because those people are already predisposed by having liver damage from their alcoholism. And obviously, don't use it in people who are hepatically impaired. So acetaminophen, not good on the liver. There was a boy I went to high school with who had some kind of illness, I don't know, and he took Tylenol. He didn't know how much he should take. We were probably in 8th grade, and he overdosed on Tylenol and was in the hospital for like a month because he went into liver failure from taking too much Tylenol. But he lived and now has a job and is doing normal. So that's good. All right, a couple questions. Which drugs affect COX-1 and COX-2? Aspirin, ibuprofen, and naproxen. And what's another name for these drugs that inhibit COX-1 and COX-2? Non-selective NSAIDs. Which drug is COX-2 specific, and why is this good? Celecoxib, and it's good because it inhibits only the inflammation, and you're going to maintain all of your good homeostatic mechanisms. So less risk for stomach ulcers. You know, it's not going to thin the blood if you don't need that. Your kidneys are going to hopefully be a little more okay. So if someone just has inflammation, it's a little bit better to use a COX-2 specific NSAID. So another name for this is a selective NSAID. And which drug has the greatest risk of hepatotoxicity in overdose? Acetaminophen. You don't want to take too much because it is hard on the liver. All right, that's all for this week. And if you guys have any questions, feel free to email me or any of the other tutors. Don't hesitate to reach out for help. All right, have a great Memorial Day weekend and stay safe.